Good morning, all of you. I am Dr. N. Vijay Lakshmi, Dr.NVL Ayurcare in Hyderabad. For contact, my phone number is 8125863274. Dr. N. Vijay Lakshmi, MD Ayurved, postgraduate in therapeutic yoga and MA Sanskrit, working as a professor. Today's topic is Murivenna. Muri means wound, enna means oil. Literally, Murivenna oil means which heals the wound, that is Vrana Ropana, and it is helpful in skin diseases, cuts, wounds, and ulcers. And Murivenna is made up of herbal juices and paste that offer ultimate relief and muscle pain. So this is anti-inflammatory, that is pain relieving oil, very much helpful in ligamental tear, strengthening the muscle, strengthening the bones and joints, effective in non-healing ulcers like diabetic foot ulcer, edema, any सूजन होता है उसमें, widely used for relieving pain and inflammations due to injury and restores the mobility of the joint, and also useful in fungal infections, skin diseases, ringworm infection, burning sensation in the skin diseases, thrush, fungal infection of nails. And it is useful in pain in tennis elbow, shoulder dislocation, back pain, post surgery pains, spondylitis pain, stiffness, slip disc, ligament and tendon pain, spinal injury, acute soft tissue injury, sports injury, arthritis. And Vranaropana, wound healing, and it is Dahahara. For example, in a spine problem, when there is desiccation of the disc, that is in between the vertebrae, there is a cartilaginous tissue due to wear and tear and stress and age related changes, diabetes. So due to all these factors and thyroid, the cartilage which is present in between the vertebrae, it will be degenerated. There will be degenerative changes in the disc. Because of that, there is severe burning sensation due to osteophyte formation on the vertebra, osteophyte complex. So there will be some wound like sensation in the spine which gives burning sensation or which gives some sort of irritation. In these degenerative conditions, in my 25 years of practice, this is the best medicine for degenerative changes of the spine. And also in varicosity, in my opinion, this is the best medicine. Varicosity, we have to apply warm oil gently in upward direction. In all different conditions, we have to apply in downward direction, right from head to toe. But in varicosity problem, we have to apply warmly without giving any pressure. This is very, very important. You have to apply the warm oil in upward direction. Okay, in varicosity, this is the best medicine. And to pacify the pain and inflammation and the burning sensation wherever, whether it is in spine problem, radiating spine problem, or in wounds, you can apply it externally. And balya for muscle strengthening and to treat the pain from trauma also, it is excellent drug. And this Murivenna oil is very good and absolute remedy for arthritis, sprains, fracture, muscle cramps, dislocation, and other injury related problems. And some people will go to the gym out of enthusiasm, they will do too much exercise, so that resulting in soreness of muscle, excess gym, more lethargy, and also due to bad posture for long time, muscle pull will be there. And in all these conditions, it is the best remedy for instead of taking analgesics, anti-inflammatory, the side effect is acidity. So naturally you can externally warmly gently apply this oil The pain in frozen shoulder, hip pain, soreness of the muscle, strain of the muscle, sudden pull, so which leads to immense discomfort. So in all these conditions, pain relief and inflammation relief will be there. Next one is Sandhi Sula, that is in all osteoarthritic changes where there is degeneration of both the knees or single knee. You can apply regularly. Depending on the condition, you have to add some more oils. Depending on the situation, we have to advise. And Sandhi Sula, when only pain is there, excellent medicine for external application. Next condition is Kati Prushta Sula. Kati means lumbar region, Prushta back. So pain in spine and lower back, external application very good. This usage of this is very good. And Mamsagata Vata, it relieves the muscle pain and myalgia. And how we have to use this oil? First one is Abhyangam. What is meant by Abhyangam? Abhyangam means warmly you have to take the oil in a bowl. You have to keep that small bowl in a water. Hot water, so that it gets double steam method, so that the oil will be heated indirectly. So warmly you have to apply thoroughly, gentle massage throughout the body, pura body mein tel lagana. It is called Abhyangam. So Abhyangam is a biofeedback mechanism, that is biologically you are stimulating, you are giving a stimulus to the brain. In turn, the brain will respond and give the stimulus, because nervous system and this spinal cord, this nervous system and skin both originated from ectoderm. So biofeedback, samanyam vruddhi karanam, that means biofeedback mechanism internally giving a stimulus. In return, brain will give written message. So Abhyangam is a very scientific procedure in all neurological conditions and in spine related problems. This is Abhyangam means for general awareness, external body oil application. Next procedure is Pichu. Pichu means you cotton swab or cotton cloth you have to take and dip that cotton cloth in warm oil, and then wherever it is sprain is there, injury is there, frozen shoulder is there, or any inflammation, burning sensation, on that part you have to cover with it cotton oil dipped cotton swab on that particular area. You can bandage or leave it like that for half an hour to 1 hour depending on the severity of the symptoms. Next one, it can be used as a Kati Vasti procedure. Kati Vasti means Kati is lumbar region. In lumbar spondylitis or listhesis or spondylolisthesis or protrusion, and this is edema in the spine, disc protrusion, IVDP conditions. In all these conditions, wherever there is pain, discomfort, unable to move, stiffness, all these conditions you can by putting a bridge with urad dal, that is black gram, in that we have to pour warm oil for about 20 to 45 minutes depending on the tolerance of the patient. So with the skin diffusion method, the oil get absorbed and the hard nature in between the vertebrae will be rectified. So the hard tissue will be replaced, hard fibrous tissue gradually will be replaced by the cartilaginous tissue, which gives better relief in all spine related problems. And depending on the condition, depending on the MRI report, we have to take the ratio of oils. There are more than 50 oils are there. So depending on the MRI report, we have to take the oil. For example, if numbness is there, one oil will be there. Bilateral blockage, bilateral hole, foramen closure, another oil. For numbness, one more oil to be added. And for stiffness, and there is radiating pain in the back leading to sciatica, bilateral sciatica. So depending on the condition, physician has to, after thorough examination of the patient, physician has to plan which oil in which ratio has to be added. Okay. Next one is Parshni Shula, that is calcaneal spur, and these are the different conditions. And sometimes bandage also should be done. Sometimes local topical application on the affected part can be done. So in all cervical, lumbar spondylolisthesis, ligamental tear, it is beneficial in golfer's elbow, Achilles tendon, tennis elbow, jumper's knee, swimmer's shoulder. So in all, these are all the conditions in which muscle is in excess usage, it gets fatigue. So muscle soreness will be developed, injury. In all these conditions, you can 100%, you can use it as an external medicine to get 100% relief in pain and inflammation. So this is about Murivenna. For any further details, for any queries, you can contact me on my phone number 8125863274, Dr. N. Vijayalakshmi.